if we make a slight correction in the cornea, we are able to ablate the cornea, we use the term, then we are able to change the refractive power of the cornea. Inclusion criteria and exclusion criteria are very, very important so that we are able to give you the best results. Once these few tests are done, the patient can just come in for the procedure in the morning, just finish the test in 10-15 minutes, the procedure can be done. Hi, I'm Dr. Susan Verghese, Director, Smart Vision Hospital. Many people have the question, what is refractive surgery? Can I get rid of my glasses? And if you are below the age of 40 years, my answer is yes. And if you are over the age of 40 years also, my answer is yes. Many people know about LASIK. It is a term which has been used, and LASIK indicates laser-assisted keratomileusis. So this procedure, what exactly is it? So earlier we had a lot of other procedures called keratectomies, but now this is such a wonderful procedure whereby you're able to correct your eye power. It is because the eye is such a beautiful organ. There is about 40 diopters of power which is there in the cornea, 20 diopters of power in the lens, and the total refractive system is about 58 to 60 diopters of power, so that the light rays which are coming from infinity can be focused on the retina and the macula. Now what happens is, if we make a slight correction in the cornea, we are able to ablate the cornea, we use the term, then we are able to change the refractive power of the cornea and the light rays which were not in focus because of myopia, that is what everyone knows as minus power. Then we are able to correct it and the light rays can focus on the retina. So we have two procedures. One is LASIK, and then we have femto-LASIK, we have SMILE, we have a lot of other procedures like INTAX. So we use all these different procedures whereby once we know what the power is exactly of the person, we are able to feed it into the software of these machines, and then we are able to do the correction. The correction itself is just hardly 10 minutes procedure, but first what we need to do is see a few things to see whether the patient is the right person to do this procedure on, because these inclusion criteria and exclusion criteria are very, very important so that we are able to give you the best results. After the procedure, the power should be absolutely fixed and it should be at zero. So to prevent any changes after that, we need to make sure that the patient is over 18 years, the power has reached the end point of refraction, the cornea is fine, that is the topography of the cornea we check with the test called oculizer, and the retina if it is all right, because especially in myopes we find that the retina can get stretched and there can be weak points in the retina. If there are weak points when we examine, we do a simple laser whereby we are able to correct it and heal the retina also. So once these 4 tests are done, we do a test called Schirmer's test to check whether the corneal dryness is also there. Once these few tests are done, the patient can just come in for the procedure in the morning, just finish the test in 10-15 minutes, the procedure can be done and he can be back at home with absolute clarity of vision. So they come in at after the age of 40 also. We tell them we can give you a procedure called PRELEX. Now that is called presbyopic lens exchange. We do it in those who have clear lens. We are able to implant a clear lens, remove the clear lens and implant the multifocal lens into the eye and give you absolute clarity of vision. So these few procedures are all there. Do come in and have it done.